Welcome. We'll be discussing bimanual manipulation as a means of obtaining a centric relation record. When done properly, this is one of the most accurate methods to correctly record the jaw joint position. As you can see, I'm going to lightly rest my fingers along the inferior border of the mandible, posteriorly supporting the angle of the mandible. My thumbs will lightly rest on the anterior portion of her chin. I'll have her open and instruct her to relax while I place light downward pressure on her chin and light upward pressure supporting her inferior border of the mandible. I'll then try to deprogram her jaw by lightly trying to direct the opening and closing of her jaw. Once you can feel that she has relaxed enough, with that light support, I'll instruct her to close and stop when she first feels her tooth contact. We'll identify that location, repeat it several times to identify where and if it is repeatable. As you can see, she identifies the same location twice. Again, demonstrating the technique from a different angle. Proper support is applied to her mandible and she closes slowly until that first tooth contact is identified. You need to record that tooth location once that contact is identified. Now we'll demonstrate the CR-CO slide, which is the first tooth contact and then closing into maximum intercuspation. You'll see here, first tooth contact is identified, then she fully closes into MIP, and you will see the slide. One more time. Again, she closes until that first tooth contacts, and then I'll instruct her to close fully, and you'll see the discrepancy from CR to CO. I'll demonstrate using a Triad Jig, a technique that eases the recording of centric relation using bimanual manipulation. We adapt the triad to the anterior maxillary incisors. Properly supporting her mandible, we instruct her to close slowly into the triad until she has about 1.5 millimeters of space between her teeth. This is repeated several times to confirm its accuracy, and then we use a light curing unit to cure the triad while in her mouth. Once the jig is fully cured and I have confirmed the repeatability of the jig to record the CR position, I will then apply GC exabyte registration material to the maxillary posterior teeth. Notice I'm applying just enough that I will be able to record both the maxillary occlusal surfaces and the mandibular occlusal surfaces. I will then support her mandible properly as previously described and have her close into that triad jig and remain there supporting her mandible until the bite registration material has fully cured. Once it is fully cured, see me there testing it to verify that it has cured. I will then remove the material, evaluate it to ensure that I've recorded both the maxillary and mandibular occlusal surfaces. Once I've confirmed that, I will proceed to trim the record. To properly trim the CR record, I'm using a 25 blade scalpel. This video is not running real time. It has been sped up to help demonstrate the process, so please be careful as you trim any record as to not cut yourself. As you can see, I'm removing the central anatomy of each tooth as well as any interproximal anatomy, leaving just the residual cusp tips. I do this in order to help make sure that these records seat fully between the diagnostic casts we've received earlier. This will improve the accuracy of the CR mounting in our articulator. There are a couple key points that I'd like to point out to ensure this technique is really done properly and easily. Number one is This is not really a manipulation of the mandible. It's really just supporting the mandible, helping it seat fully into the fossa of the cranium, and allowing them to close naturally and record that jaw joint position. If we do that and just properly support the mandible, this technique is relatively easy to accomplish and obtain a record. The second important note to help this technique be successful is to instruct the patient that while you're trying to deprogram their mandible and record this position, to have them not put their teeth fully together unless they're instructed to do so. This will help decrease the muscle memory and improve the accuracy of the record. I hope you enjoyed this technique and find a way to incorporate it into your practice to help improve your outcomes and success with those patients that you are treating. Thank you.